Hello everyone. In this video, I would like to share information to parents whom children are at the risk of autism or ASD, which also means autism spectrum disorder. I have seen many parents struggling initially for the identification and diagnosis of children whom they think that they might be having autism. So in this video, I would like to share some information in form of some directions which might help parents to get the child diagnosed autism. First of all, many parents ask me question, where should I go for the identification and diagnosis of autism? Or if my child has autism, which grade autism it is? So for this, I would suggest all parents who think that their child might be having autism should go to child neurologist, child psychologist, or occupational therapists. These are the healthcare professionals who will help you to identify and get your child diagnosed with autism if the child is having autism. The other question which I get through many parents is there any test available in the market for the diagnosis of autism? So let me clear to all of you that there are no any medical tests available in the market for the diagnosis of autism. It's only the information given by parents or caregiver and observation of child through which diagnosis can be made. And this diagnosis can only be made through specialized healthcare professionals, as I said, child neurologist, maybe child psychologist, or occupational therapist. So, what I would recommend is, and which I follow in my center, there are two steps which can be followed for the identification and diagnosis of autism. First step is to go through developmental screening. Usually, whenever you go to any pediatric therapy center, your child will go through this developmental screening process, in which you might be asked many questions. So, this screening will help you to identify your children whether your child is exhibiting any signs or symptoms of autism or not. There are many standardized tools which are available in the market for the in the form of developmental screenings, such as MChat and ages and stages questionnaire. These are the two tools which are very frequently used for the developmental screening, especially in the case of autism spectrum disorder. Once this is done and you feel that child is falling under the category of autism, then a thorough comprehensive developmental evaluation is required for the diagnosis of autism. Again, in this comprehensive developmental evaluation, all important areas of developmental areas of the child, right from physical, cognitive, social, emotional, communication, all these areas will be assessed. There are certain, again, standardized tools available in the market for the diagnosis of autism. One of them is CARS, Childhood Autism Rating Scale. Another is ISHA, Indian Scale for the Assessment of Autism. Especially for Indian population, ISHA is standardized and in most of my cases, I recommend this to children, and as for my experience, the accuracy rate is very high. So I would suggest to go for this. Once these standardized tools are administered, then it is easy to diagnose whether the child is having autism or not. Apart from this developmental screening and developmental evaluation process, in case of ASD, there may be chances of having sensory issues. So, if there are sensory issues, then there are some other tests which are also recommended. For example, sensory profiling. Sensory profiling is again a questionnaire which is done by caregivers or parents. Apart from it, there is one more standardized test which is used, sensory integration praxis test SIPT, for identifying the sensory issues. So, guys, if you feel that your child is at the risk of autism, what you need to do is first you go to a proper specialized health professional, maybe a child neurologist, child psychologist, occupational therapist. Then don't go for any medical tests. Go through this developmental screening, developmental evaluation process. I would also recommend to use these standardized tools for both the purposes. And if you feel that there are some sensory issues which are disturbing the child, then you can also go for sensory profiling or sensory integration praxis test. I hope this video will help you to get your child identified autism, or if the child is falling under the category of autism spectrum disorder. Thank you very much.